Hello everybody, I am Dr. Along and I am a psychiatrist and I am here today to talk on mental health and substance abuse. Mental health is defined according to the World Health Organization as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contributions to his or her society. You see, we all have mental health. It is just as important as physical health. It is not just about mental illness or disorder, which is just a part of the bigger picture. It is best to think about us as being in a continuum, rather than being mentally well or mentally ill. We all are in the continuum and we move up and down this continuum according to the factors such as our genetic makeup, our upbringing, the life circumstances, and the stresses we are under. At one end of the continuum, we have negative states of mental health such as depression or anxiety. And at the other end, we have states of positive health, such as when we are thriving, we are content and fulfilled. The aim of mental health intervention is to help people move up the continuum so that people reach their full potential and live satisfying lives. A positive mental health means, therefore, to be resilient, being able to cope, being in control, being confident, feeling good about oneself, being able to manage and express one's emotions, and the ability to build and maintain strong, healthy relationships. We have all experienced periods when we felt stressed, worried, anxious, sad, frightened, or even angry. These are all normal emotions. However, when emotions become severe enough, they interfere with a person's ability to function daily. And these feelings become persistent over time, and it can develop into mental distress. Mental illness is defined as a substantial disorder of thinking, mood, the perceptions, orientation, or memory that grossly impairs judgment, behavior, and the capacity to recognize reality, or the ability to meet ordinary demands of life, and mental conditions associated with abuse of alcohol or drugs. The clinical features include changes in one or more of the following, such as thinking, mood, perception, conduct and behavior, personality. Some examples of thinking problems could be obsessions, negative thoughts, worries, suicidal thinking. Problems about mood can be sad, feeling sad or down, or the extremes of mood, the highs and the lows, irritability, hostility. Perception, it is the ability to see, hear, or become aware of something through the senses. This can be disturbed, and examples are like hallucinations. Conduct and behavior becomes disruptive, become deceitful, even aggressive. Personality changes can take place with different causes of mental illness. These clinical features tends to last long, can cause significant distress to the person experiencing it, and leads to decline in the personal, social, and occupational functioning. Adolescence, when we talk about adolescence, we talk about a person between the age of 10 to 19 years old. This is a unique and formative time. Adolescence is a crucial period for development and maintaining social and emotional habits important for mental well-being. These include adapting healthy sleep patterns, taking regular exercises, developing coping, problem solving, and interpersonal skills, and learning to manage emotions. Multiple physical, emotional, and social changes, including exposure to poverty, abuse, or violence, can make adolescents vulnerable to mental health problems. Promoting psychological well-being and protecting adolescents from adverse experiences and risk factors that may impact their potential to thrive are critical for their well-being during adolescence and for their physical and mental health during adulthood. Supportive environments in the family, at school, and in the wider community are also very important. An estimated 10 to 20% of all adolescents globally experience mental health conditions, yet these remain underdiagnosed and untreated. Multiple factors determine mental health outcomes. The more the risk factors adolescents are exposed to, the greater the potential impact on their mental health. Factors that can contribute to stress during adolescence include a desire for greater autonomy, pressure to conform with peers, exploration of sexual identity, and increased access to and use of technology. Media influence and gender norms can exacerbate the disparity between an adolescent's lived reality and their perceptions of or aspirations for the future. Other important determinants include the quality of their home life and relationships with peers. Violence, including harsh parenting, bullying, and socio-economic problems, are recognized risks to mental health. Children and adolescents are especially vulnerable to sexual violence, which has a clear association with detrimental mental health. Adolescents with mental health conditions are in turn particularly vulnerable to social exclusion, discrimination, stigma, educational difficulties, risk-taking behaviors, physical ill health, and human rights violations. Some important mental health issues in adolescence can be: 1. Emotional disorders. Emotional disorders commonly emerge during adolescence. In addition to depression or anxiety, adolescents with emotional disorders can experience excessive irritability, frustration, or anger. Number 2, behavioral disorders. Childhood behavioral disorders include attention deficit hyperactivity disorders, which is characterized by difficulty paying attention, excessive activity, and acting without regards to consequences, which are otherwise not appropriate for a person's age, and conduct disorders with symptoms of destructive and challenging behavior. Childhood behavioral disorders can affect adolescents' education and may result in criminal behavior. Eating disorders, which more frequently affects females than male. The conditions such as anorexia nervosa, bulimia nervosa, or binge eating. These disorders are characterized by harmful eating behaviors such as restricting calories or binge eating. Psychosis. These emerge in late adolescence period and early adulthood. Symptoms can include hallucinations or delusions. Suicide. Suicide is the third leading cause of death in older adolescents, that is between 15 to 19 years of age. Risk factors for suicide are multifaceted, including harmful use of drugs and alcohol, abuse in childhood, stigma against help seeking, barriers to accessing care and access to means. The last, risk-taking behaviors. Many risk-taking behaviors for health, such as substance use or sexual risk-taking, start during adolescence. The word substance abuse can simply be defined as a pattern of harmful use of any substance for mood-altering purposes. More technically, it can be defined as the use of illicit drugs or the abuse of prescription over-the-counter drugs for purposes other than those indicated or in an undirected manner or quantity. Some common forms of substances abused are tobacco, alcohol, opiates like heroin, brown sugar, codeine, or even the ones we have heard as spasmoproxyphone. Also cannabis, which is also known as ganja and marijuana. Inhalants, caffeine, cocaine and ecstasy. The last two, it's not very popular in our part of the world. Key risk periods for drug abuse occurs during major transition in a child's life, such as changes in the physical environment, development, for example, puberty. Then social situations such as moving, getting transferred, parents divorcing, loss of a loved one. There are different stages of drug use. The first could be experimental use. Experimental use is this one-time use, maybe an occasional use, or use in moderation. The next use could be the problematic use, where because of the use of the drugs or alcohol, of the use of the substance, the person get into trouble. Maybe the grades start falling down, or maybe has relationship issues, social issues, or occupational issues. And the third is the dependent or the addiction part, where the person spends considerable time procuring the substance, using the substance, and recovering from the substance in a vicious cycle. The reasons for drug use are usually hunger, boredom, fear, feelings of shame, depression and hopelessness, difficulty falling asleep, need to stay awake, lack of recreational facilities, social isolations, or loneliness. The effect of drugs, they tend to lessen the hungers, creates a sense of excitement, generates a feeling of bravery, helps to forget, produces drowsiness, or some help the user to stay awake, offers entertainment, provides a sense of connection with fellow users, and helps socializing. What are the effects of substance in students? There are problems with memory and other cognitive functions, They increase the risk of infectious diseases due to hazardous behavior. There are drop in grades and difficulties in school. There are strain on family relationships, loss of interest in activities previously enjoyed. There can be overdose, accidents, and injuries too. Among the many concerns faced by teachers and others who work with youth are mental health issues and substance use abuse. This can cause significant negative effects in the life of a youth. From a teacher's perspective, this may manifest itself in many ways, such as behavioral problems and poor academic performances. The role of teachers here is to bring about awareness on the mental and emotional changes occurring during adolescence. Support the students in accepting these changes as part of growing up. Help the students deal with body image concerns and enhance self-esteem. Teachers can be role models and dissuade the students from abusing drugs. This is all the more important if young people, they do not have supportive families back home to guide them. Young people may have to contend with the pressures associated with experimentation and with life in a complex and demanding society. Substance abuse is basically a mechanism to cope with or escape from feelings of insecurity. To help students realize that they are not alone in facing these challenges, that there are a variety of healthy ways to confront them. To manage the problems related to mental health and drug abuse, schools also have a significant influence on the behavior and development of children and adolescents. Education institutions provide an efficient means of promoting the health, academic, and emotional development of young people. A holistic educational approach to mental health promotion increases mental well-being and reduces the risks for mental disorders to develop in children and adolescents. A comprehensive mental health program should be part of the school health program. The program should include health instructions, guidance, or counseling at all grade levels, easily accessible health services, a nurturing and safe environment and interaction with family and community organizations. The aim of school-based intervention is to create an environment that will strengthen children's coping abilities and allow them to counter the environmental stresses and disadvantages they face. The key message here is that adolescence is the age of learning. New things and experimentation is a part of learning. Therefore, in the process of learning new things, they take risk in the absence of information and new skills to deal with these situations. This involves trying out new experiments, some of which may be risky and even dangerous. They do this for various reasons: to behave like adults, because of peer pressures, and for the sake of experimentation and finding out themselves. Therefore, it is important for us to impart education and equip them with life skills. So all those issues may affect the life of adolescents adversely could be handled in a positive manner. Thank you.